Hello, good morning to one and all. I am Vadrivu Soni, in charge and assistant professor from Department of Home Science. Today, as a part of a subject, health, hygiene and wellness, we are going to discuss about the various bacterial infection. In that, we are going to talk about the definition of different types of disease, causes, mode of transmission, symptoms and preventive measures. In these things, we are going to discuss about the typhoid, fever, tuberculosis, and dysentery. So let's go into detail of each individual infections. So coming to the first part is typhoid fever. So we can define it as it is a bacterial infection which is caused by the major microorganism Salmonella typhi. It primarily affects the intestinal tract and bloodstream, leading to high fever, stomach pain, and other symptoms. Typhoid fever is also called as enteric fever. It leads to high fever, weakness, digestive disturbances. If untreated, it also can be a life threatening program. So now coming to the main mode and causes. If you see the causes, typhoid fever is caused by ingestion of food or water contaminated with Salmonella typhi bacteria. The bacteria spread through the fecal oral route, meaning they enter the body when a person consumes contaminated food, drink or touches their mouth with contaminated hands. So if you see the flow chart, the various modes of transmission, it is through contaminated water and poor sanitation and hygiene, carriers of the bacteria. In contaminated water and food, drinking or eating food washed in contaminated water can be mode of transmission. Contact with infected feces due to inadequate hand washing, and some people recover from typhoid but continue to carry and spread the bacteria without showing any symptoms. This is called as a carrier of bacteria. After a period of disease, the infection can be passed from a other person to person, right? So these are the two things, causes and modes of transmission. Coming to the symptoms, this is the most important thing. As it is says, its name means fever, which says that it has a high fever that can last for weeks if untreated. It often gets progressively worse even after a few days. So let's see a clear picture of different symptoms. They have high fever. It can reach up to 103 degrees or 104 also. Weakness and fatigue, loss of appetite means you don't feel like eating, headaches, severe body aches and muscle pains, and severe abdominal and bloating. And the other gastrointestinal symptoms, you can say constipation can be at an early phase, diarrhea at the later stages, nausea and vomiting are the most commonly seen, enlarged liver and spleens, and severe symptoms if untreated. If you're not under a treatment, then you have a chance of getting intestinal perforation, which is nothing means holes in the intestines, leading to peritonitis, which is nothing but a life threatening infection. And you can also experience a severe dehydration or delirium or confusion. So these are some of the symptoms where you can witness if you are on typhoid fever. Now coming to the most important measures, preventive measures while you are on typhoid fever. The most important thing is good hygiene, proper sanitation, and vaccination plays a major role. Safe food and water practices. For example, you can say drinking water, which is where purified water or boiling water. Avoid raw or street foods. Eat fresh cooked foods. To maintain a proper hygiene and sanitation, wash your hands thoroughly with soap and clean water, especially after using of toilets and before eating, maintaining good sanitation and proper sewage disposal. The vaccinations for typhoid, as we know, there are vaccinations for typhoid at an early stage. These not only provides protection but also uh, helps you for the traveling from person to first person through the infections. And booster doses may also be recommended or needed for a few years. And also avoid contact with an infected individuals. Ensure that the food handlers do not carry the bacteria to the other person. People recovering from typhoid should maintain a proper hygiene to prevent spreading of the infections. And also see that you're taking, with the help of a doctor, you're taking a proper antibiotics for the treatment, and have a stay on fluid and electrolyte diets. Hydration is very, very much important, and the most important thing is rest and nutritional diet plays a major role. With this, we can say that typhoid also plays a major role, and see that you follow proper precautions to maintain a proper healthy lifestyle. Now, coming to the next infection, bacterial infection, is tuberculosis. What is tuberculosis? It is an infection disease that can cause infection in your lung or other tissues. TB is a contagious bacterial infection caused by Mycobacterium tuberculosis. It commonly affects your lungs, but it also affects other organs like your spine, brain, or kidney. The word tuberculosis comes from a Latin word for nodule or something that sticks out. So, tuberculosis is also known as TB. Not everyone who becomes infected with TB gets sick, but if you if you do get sick, you need to be treated. So if you see this picture, you can see the lungs, and the main, this is the way, this is a Mycobacterium tuberculosis, a microorganism which is the main cause root for the TB, right? So the next, if you see, what are the main causes and what are the mode of transmission? The main causes, as we already spoke, Mycobacterium tuberculosis is a main microorganism which spreads through airborne transmission. You can see the picture. It is a very clear, when a person, infected person, when he's sneezing or coughing or speaking, the droplets, it, as you know, the droplets are very light in weight. They can spread down easily, and that can be inhaled by the healthy person, and he has a chance of getting infected. This is how the transmission is being going on. So the bacteria, when inhaled into the lungs, way they can be remain dormant or become active. So it is called as active TB. So this is the mode of transmission. So, if you see what are the main symptoms, in the picture it is clearly saying that you have a poor appetite, night sweats, weakness, fever, dry cough, weight loss, and gastrointestinal symptoms like nausea and vomiting. And there several risk factors are also which are there when you are sleeping in a closed ventilated room, with no proper ventilation, if you have been overcrowded, if you're also having different type of smoking. All these things are some of the causes where you're getting a severe tuberculosis. So the most important things for the this TB is the lung is mostly being affected. So you can see a severe cough where blood is also being a sputum or a blood can be seen in your cough, a severe chest pain with the difficulty of breathing, fevers and chills, and night sweats are most commonly observed. And there is, you can see an unexplained weight loss with lot of loss of appetite, and you can also observe fatigue and weakness in these people. So coming to the prevention methods, how can you prevent such kind of tuberculosis by not spreading to others? First thing, you have a BCG vaccination, which has been very, very must during its early phases, and covering measures of how to cover protection, as is the picture says, respiratory ventilation. As we know, everyone now, we are most common with the mask. So people need to wear mask to provide that to provide a better functioning for her, and also a kind of preventive methods for spreading the infection. Good ventilation should be maintained, and stop smoking, and childhood vaccination, screening and early detection, regular TB screening should be there, and TB testing for people in close contact with infected individual, mainly maintaining a good nutrition and strong immunity, avoiding smoking and alcohol abuse are some of the preventive measures which have to be taken to prevent spreading the tuberculosis. Now coming to the next one is dysentery. What is dysentery? It is also one of the bacterial infection where it is a gastrointestinal disorder. It causes several diarrhea and contains blood or mucus in the stools. There are two main types. They are amoebic dysentery, that is called as amoebiasis, and bacillary dysentery. Right. In amoebic dysentery, if you see, it is mainly caused by a parasite, which is nothing but Entamoeba histolytica, mostly common in tropical and subtropical region. And the second one, if you see bacillary dysentery, it is caused by the bacteria Most commonly observed, the causative organism you can say is Shigella, and the others are E. coli you can say, or Salmonella, or Campylobacter was also some of the reasons for the bacterial bacillary dysentery. And it is also one of the most common type of dysentery which has been observed. Right, these are the two pictures you can see. These are the two microorganisms for amoebiasis and bacillary dysentery. Now, what are the main causes of dysentery? The parasite or the bacterial infection that causes dysentery are very contagious. People usually transfer the parasite or bacteria to each other when they poop or through the oral fecal oral matter, or from an infected person who gets into another person's mouth. That is transmission through a drop way. Transmission can occur during food preparation by someone who doesn't wash their hands, or poor sanitation hygiene, drinking contaminated water, sexual contact, especially involving the anus. And now the bacterial dysentery occurs when a foreign bacteria enters your body and get infected, becomes severe. Some of the most common bacteria that causes bacillary dysentery include Shigella, Salmonella, Campylobacteria, E. coli, and others. And amoebiasis occurs when a particular parasite enters your body. Now, coming to the main symptoms, if you observe, I'm talking in a common way. Frequent diarrhea with blood can be observed, abdominal pains and cramps, nausea and vomitings, fevers and chills, severe dehydration, which can be observed by dry mouth, dizziness, reduced urination. Then you have a constant feeling of needing to pass stools, right? The severity may include weight loss due to malabsorptions, liver abscesses in amoebic dysentery can be observed, intestinal perforation, which is if untreated. Then it also, you can see a painful stomach, abdominal pains, right? Fatigue are some of the most common observed symptoms in amoebic or bacillary dysentery. To avoid all these things, or the ways of how to prevent dysentery are, the best thing is safe food and water practices, proper hygiene and sanitation, avoid direct contact with infected individual, stop sharing utensils and towels with an infected person, practice good hygiene practices, use clean towels and ensure proper disposal of human waste, food keep food covered to prevent contamination from flies, wash hands with soap after using the toilets and before eating, ensure proper cooking of meat and seafoods, avoid street foods and raw fruits and vegetables, and it should be washed in a clean water, drinking boiled or filtered water. With this, I can say dysentery is also a contagious disease where it is very serious intestinal infection causing blood diarrhea, spreads through contaminated food, water, and poor hygiene. And the main thing is prevention is cleaning, safe drinking water, hand washing, and proper sanitation. And the main thing for the all the different disease which you have seen is you have vaccines for everything. So vaccines plays a major role, and final conclusion I can say vaccinations, poor hygiene, proper maintenance, ventilation, and masks are plays a major role.
According to the BRAC Research and Evaluation Division, Bangladesh, they're saying that how to maintain hygiene and use of safe drinking water in the crop field and at an household. In crop field, they're saying that carry safe drinking water in a covered clean jar or bottles to the field. At household levels, treat water by current standard practices and preserve treated water. Use hygiene latrine and wash your hands with soap or detergents before cooking and eating food. So these are some of the protocols being followed. The main tagline they say is be clean, drink safe water, and live a healthy life to maintain a standard and healthy lifestyle pattern.
Healthy lifestyle. Thank you.